I think it was an overview paper of what is just currently state of the art in metastatic prostate cancer. Many things are changing. I think it's like in breast cancer or in lung cancer. We are heading an area also in prostate cancer of personalized treatment. And I think it's crucial to analyze genetics at a certain point of time, especially in the metastatic patients that had already have standard treatment options. So I would guess, for example, olaparib or all other DNA repair targeting agents will play a role in the future. And I think this is summarizing the sequence of drugs that we need to deliver. And finally, I think molecular tumor boards and genetic analysis will bring some benefit to this treatment armamentarium. The PREFERE trial, however, was a trial, it was, well, a randomized trial like the PROTECT trial in Germany, where we randomized all active treatment options against active surveillance, and including brachytherapy, for example. So 4 treatment options, radical prostatectomy, radiotherapy, brachytherapy, and active surveillance in a low and early intermediate risk. So it was a good setup. It needed a lot of patients, and finally it had to be closed prematurely. But in our publications, we concentrated on the active surveillance cohort. And what came out is that this cohort is feasible. So active surveillance is feasible also in intermediate risk prostate cancer patients. However, the rate of active treatment during active surveillance is high. But at least in some patients, you can be sure that they are spared active treatment for 2 or 3 years. I think this is an important message also from our randomized trial. And if you combine this with prospective data from Toronto, from Memorial, where they also looked into active surveillance into early intermediate risk patients, they saw that it is feasible. So I think it's a selection process. In contrast to PROTECT, I think we need to have a better staging, like MRI staging, before we encounter inactive surveillance in this more or less high-risk population. But it is feasible to delay radical prostatectomy, and this was actually the message of this paper.